Welcome to Doctors on Call. I'm Jenna Miller. If you live with pain, you are not alone. Pain affects more Americans than diabetes, heart disease, and cancer combined. Pain attacks the human body at every vulnerable target, muscles, bones, and joints. Each person and their pain are unique. Over 20% of U.S. adults have chronic pain, and pain sufferers. Statistics show that women are more likely to experience pain than men. The best way to manage your case could be very different from what works for someone else. Pain management is our topic tonight on Doctors on Call with our guest, Dr. Belle Razafindrabe.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Belle Razafindrabe earned his medical degree from Université de Madagascar and completed his residency and training in physical medicine and rehabilitation at the Loma Linda University Medical Center in California after spending a year of internal medicine internship at the same institution. Dr. Belle is certified in physical medicine and rehabilitation by the American Board of Physical Medicine and Rehabilitation. He moved to Great Bend in 2005 and is president of Pain, Spine, and Rehab, PA. Give us a call at 800-337-4788, toll-free with your questions about pain management on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician. While the first calls come in, we'll go ahead and start with some questions of our own. Thank you so much for returning and being our guest tonight. First of all, let's talk about how to minimize the use of pain medication.
Very important question. The first thing we need to minimize the use of pain medication is to really know the underlying causes of pain. There are multiple causes of pain, and address all of those causes of pain. It is important for patients to know their pain, ask questions, and this, especially when before you come to a physician, describe your pain by yourself first and say, hey, where is my pain? Does my pain stay in one place or moves? And you may also ask, do I experience numbness, tingling, burning, stinging? Those type of questions can indicate that you have some nerve pain. Is my pain constant, or does it really come and go? So describe your pain, write it down. How does this pain impact my quality of life? What I'm currently doing to manage my pain? Is there anything that I could not do because of this pain? Those are questions. What pain medication I've taken in the past that worked for me? So if you learn about your pain, do I have concern about taking pain medication? Those will help you know your pain, and then you come to the doctors and describe it to the doctors, and then you can ask questions. By knowing exactly what pain you have, there will be an easy way to find out alternative treatment, because pain medication is not only the treatment for pain, it's part of the comprehensive management of pain, but not solely the main treatment for pain.
What is the goal of pain management?
That is a very good question. The goal of pain management is to help the patient to return in the highest level of function and activity. That's the main goal, to help patients to reach the highest level of activity and function, and also quality of life, independence. The quality of life involves emotion, physical, and social. So if someone is in pain and that affects his work, affects his relationship with family at home, those are quality of life. And if this pain limits this person from going anywhere work, that is a problem. So the goal is, how can I do to help this person be back to work? How can I help to get this person go back to study, to school, and all of that? So that requires lots of combination of disciplinary actions.
Okay, what are some of the latest advancements in pain management?
Thank you for the question. For the purpose of improving patient functioning, then we need to dig into the source of pain. Well, if you mention about, hey, I have back pain, that is a very vague statement, because as we see back, the spine has a lot of structures. And if you look at the spine like this, we have disc, we have nerve, we have joint, and there is ligament, and so on and so on. If we do have back pain, which of those are hurting? So with the specific question, we need to find out, is this disc-related pain? And disc-related pain can be just the disc itself, or the disc pushing and impinging on the nerves. If it's a nerve pain, is this nerve pain really by itself, or because of the narrowing of the opening of the nerves that impinging on the nerve and created, we call it sciatica, radiculopathy, root irritations? Or is it really arthritis? This joint has, it can be affected by arthritis, become stiff, become painful. It may have spur, it has deposit, and so on and so on. So with a good question, we can really pinpoint exactly the origin of pain. So the latest would be into minimally invasive treatment of spine. There are conditions that I would say many adults have experienced back pain at least once a year. But when this pain becomes chronic, non-stop, then you need to find out the source of it. For instance, traditionally we use fusion for back surgery if it has arthritis, if it has disc problems, and the fusion will be having hardware from the back to the front and fuse the back and fuse it so you cannot move much. There will be use of that. But nowadays there is a treatment that can be done in about 45 minutes using minimally invasive treatment. For instance, this is a small tool, which is a spacer that is made of titanium. And with this type of treatment that can be implanted at the back of the spinous process like this, it will help open up the space where the nerves comes out. It will probably also help some of the disc issue, and especially spinal stenosis. The ligament inside the spine, the spinal cord, can be really tight and narrowed. And with a spacer like this, it will open up those space. That is one of latest minimally invasive treatment using a spacer in between the two spinous processes. But before that, if the patient already say, hey, have spinal stenosis or tight spine, that means that the spine is squeezed by this underlying bone. You need to clean it first. And that cleaning of the spine can involve remove all of this bone in the back of the spine, which will be kind of big surgery. But now we can do that percutaneously or through a small incision of the back, and we can introduce that small type of spoon and get into the area and clean out the ligament, the bone spur, and so on. We need that cleaning of the spine to relieve the pressure. And after that, if it still has, then we can use spacer. So that is another good latest. This is another instrument that we have, tools called fusion. In the past, there are, and still we do now, a big fusion that will hold the spine together so it not move much. With people we have disc pain. When you bend forward, you have a lot of pain because of the disc is much pressure. This type of tools will keep the spine rigid, keep the spine pretty tight, so it won't bend forward much or backward, and will keep the disc in place. So those can be done 45 minutes in the clinic as outpatient. So those are the latest tools to minimize the post-operative recovery. Is very, within a day or two, people can go home, can function again, and the wound can be taken care of in 10 days, remove the suture, and it's back to normal. So those are a few things that is really, I think it will be a latest in pain management.
Excellent information. We're going to go to the phone lines. We've got a caller now. This is Brian on the line from St. Francis. Go ahead with your question for Dr. Bell. Brian?
Yes.
Yes.
Hi. I was wondering what is the treatment for neuropathy in the feet?
Thank you, Brian. Treatment of neuropathy in the feet. Neuropathy has a multiple origin, and the most common cause of neuropathy is from diabetes. And most likely those affecting both the feet. And usually start from the farthest from the spine, which can start from the toes and move up to the ankle, and even if it's really advanced, it can be causing pain up to the legs. So we call it distal symmetric neuropathy. Some of the neuropathies are very difficult to find out exactly what caused it, but because of this as a diffuse and involve multiple nerves, there is no block that really will help that much. So you need to use something by month, like medications for nerve. There's a medication that's designed for that, like gabapentin or Lyrica and something like that. And you can use also topical that is used for rubbing the feet. Those can be the lidocaine anesthetic. It also can be antidepressant, doxepin cream. But most important is to desensitize that feet that is really painful. Way to do it is using modalities cold and heat combined. You can use cold as you can tolerate, and then alternative heat and cold and heat. Try to desensitize. There is nothing that is perfect, but a combination of treatment from topical modalities and some medication, and it can interrupt sleep. You might need to have some type of help with insomnia because of that as well. But if needed, maybe you need to see a doctor and can have a more specific and customized treatment for each patient.
Okay, very good information. What's the difference between acute pain and chronic pain?
As we mentioned a while ago, acute pain is a pain that happens because of a surgery, because of injury, because of medical condition that is very predictable. If you cut your fingers, we know you have pain for a while, maybe up to a week, and we anticipate and predict that recovery. When this pain lingers there, lasts more than 2 weeks, 3 weeks, 6 weeks, the definition is if pain is really there for more than 3 months, then it's become, we call really chronic pain. The chronic pain is not just only a pain, but there is some psychological component part of it, emotional, and it can have some social part of it. And this is treating the person, not only just the pain, when it comes to that. It's a chronic pain.
Now, can emotional pain lead to physical pain?
Well, it's vice versa. The emotional pain can cause physical pain, and physical pain can create emotional pain. That's the mind and body relationship. For instance, if someone is fired from work, they can experience back pain while stress or headache. That's the type of stress-related situation that become a pain. So a pain physician needs to know exactly the surrounding aspect of it. Instead of, a back pain, let's get steroid injection, because the underlying problems need to be known, and the context need to be corrected before a successive treatment can be applied. So that's part. And that's what I think when we get into a physician, pain doctors, we need to prepare to ask questions. A question such as, do you know what's really caused my pain? Questions, is testing necessary for my pain? Prepare some question, can my pain be cured or simply masked? Does my pain have trigger I should avoid? Is there any cure treatment for this pain? What's the risk of benefit of side effect of the medication I'm using? Is this pain the treatment option, what are they? What should I do to help my sleep? And all of those kind of questions that patients need to really prepare when they meet with the doctors. Know your pain, describe your pain, and ask questions. That will help those physicians to help you the most.
It's been a very stressful year for most everybody, I would say. Has COVID-19, have you found it's made an impact on chronic pain sufferers?
Well, I haven't had any specific COVID patient in my clinic, even though it has been a year. However, the pain did not have any break. Our clinic has been full and patients still need relief. The impact of the virus on pain has been known in decades, and there is post-COVID related pain as well. As we know, hepatitis, people with hepatitis C has quite a lot of pain in their joints. The same West Nile virus creates neuropathic pain. And I'm not surprised if people who have a COVID who might have some chronic type of pain triggered by the virus itself. But it will be different from one person to other.
Sure. If the pain originates from the spine, what are some methods of intervention or procedures for treatment?
Yes, there are multiple procedures and treatment for spine-related pain. Let's say headache. If some of the headache, we call it migraine. Some of the headache triggered from the spine itself. We can call them cervicogenic headache. And if we look at this head, some patient might say, I have a tense headache from here, travel to the front of my head and even to the eyes. It could be like that, and very tight neck. And so you touch the base of the neck, very tender. Those are treatment they can, this is a picture of back of the head of someone. You look at this picture and you can see that the nerves come in out of the spine, and the cervical spine of the neck, and travel underneath the scalp. And those nerves called occipital nerve, greater occipital nerves. And sometimes those nerves are pinched at the base of the skull. And by putting some local anesthetic in those areas, will really, number one, it's a diagnostic test, and number two, it's a treatment. Some patients to find relief so much from just blocking those nerves that can cause headache from the back of the neck. So that is one treatment of things that we know from the spine. Let's see if someone has pain triggered from the disc. This is a disc. Some of the disc is under pressure. We call disc decompression is a treatment having a small tools instrument that get from the behind and stabbing the disc and removing the pressure from the nucleus pulposus, then release some pressure. That's called percutaneous discectomy. Other option is for disc is microdiscectomy. Disc is that bulging went back to the spine and pushing on the nerves, and so we need to trim part of the disc that pushes the nerve. Those are some treatment for disc. How about the treatment for bone that is pushing on the nerves? Those called, it can be, depends where this bone comes. It could be a little bit more inner part or lateral part. And we can use some tools from inside here, from the back, and clean from back to the side, or there is also option that will cut through the outside in. Or you can have a surgery called laminectomy, removing part of this lamina, the back of the spine. That is part of the treatment of spine. So multiple parts. There's a lot of option for spine. There's people that had surgery and multiple scar. We don't know what much to do because multiple nerves are affected. You can see this 1, 2, 3, 4. We may have lots of nerve affected by scar tissues. For some reason, if those are become very difficult to treat, pain medication, therapy, and still having pain, this is called the spinal stimulator. We do put a trial. This has wire, and this wire gets behind the spine. And this wire gets behind the spine is attached to a generator, and the generator can be placed just in the lower back of the patient. And this generator gets into the back of the spine, and there's a place called the posterior part in the column of the spine. And those two wires send some signal, and it will block the pain from reaching the brain. And that's what you call spinal stimulator. The spinal stimulator has been improved so much, and this is a high-frequency spinal stimulator that is helping not only the pain in the leg, but the pain around the surgical area. And there are multiple companies that using it now. Their battery can last from 1 year to 12 years, and those are another treatment for spine-related pain.
Excellent. What are some tips for someone who might be living in chronic pain?
Tips for someone in chronic pain. Well, as we mentioned, the chronic pain can cause isolations, can disrupt activity, work, relationship, and so on and so on. The tip would be get into a pain center that provide comprehensive treatment. The treatment you need to involve lots of people. Involve a therapist, involve a psychologist, involve a psychiatrist, involve someone that will be a case manager, involved counseling. That well-being need to be uplifted. Given a positive view. Hey, this pain, the doctor will help treat the pain, but there is social aspect of it, biological aspect of it, and emotional aspect of that pain. Those need to be addressed. Even for the lack of sleep, also need some treatment addressed.
Now, we only have about a minute left. What are some exercises a person can do that might help reduce pain?
Exercise, overall aerobic exercise would be good for anybody. But let's see, for spine-related pain, exercise depends on what type of structure involved. There is exercise that flexion-based exercise. For someone who has bulging disc ligament that is flexion-based. Most patients would benefit from extension-based. Those exercise that will cause extension and so on. But everybody needs, we call it back stabilization, strengthening of the muscle of the spine. So those are kind of, swimming is a good one for people with back pain. Swimming because it has alternative arm and the legs and it also kind of activates the small muscle in the spine. So those are a good alternative. You don't have to do much lifting, but you just do very light weight in a repetitive way. Other aspect, as we may not have much time, is to there are a lot of procedures that we can perform to treat the cause of pain. For instance, for people with knee problems, there are procedures that will select the nerves that is really causing pain in the knee. For people who cannot really tolerate knee replacement, we call it genicular nerve radiofrequency ablation. Ablate those nerves or burn those nerves and relieve some of pain. For carpal tunnel syndrome, which require lots of surgery in the past, there are some minimally invasive treatment for carpal tunnel. There's a nerve pain that really causing people not to sleep, unable to use their hand or drop stuff. There's a big ligament that pushing on the nerves underneath, and that can be cured by minimally invasive opening that dissect that ligament and relieve pain. So.
Okay. Well, thank you so much for being our guest tonight, Dr. Bell. We could talk all night, I think. Thank you so much for joining us. For Doctors on Call, I'm Jenna Miller. Very good job.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.